time. In our C-suite this afternoon, we host Dr Mabitje Rampedi, a South African doctor, entrepreneur, and the founder and CEO of the Phelang Bonolo Healthcare, the PBH Group. Dr. Rampedi completed his MBChB at the University of KwaZulu-Natal in 1990. He then opened his private practice in the township of Soshanguve in Pretoria, which led to the founding of Phelang Bonolo Healthcare Group 16 years later. Some have described the good doctor's life story as one of black excellence, of service and generational impact. He joins us now on the line. A very good afternoon to you, Doctor. What a huge accolade to be living up to, generational impact, but certainly with the work that you've done in communities, I'm sure it is very much well-deserved. Welcome. Good to have you with us.
Good afternoon. Thanks to have me.
So, Doctor, what is it that inspired your career path in medicine? Did you always know that medicine is where you wanted to be?
Honestly, not really. I didn't know, but what I knew was that I had a passion to make a difference in people's lives. And I happened to get influenced to become a teacher purely because everybody in my family was a teacher. But then that time, the University of Natal did accept students who were coming from University of the North, Forte, and Zululand, University of Zululand. And so the initial intention was really to do science teaching and mathematics, which I started in the University of Forte. And my friends wanted to do medicine, but in retrospect, I think that's where God had decided I must be, because I serve it with passion and dedication.
What's quite interesting and pivotal about your life's path and the time and the era when you started your career, it was in the early 1990s, and as South Africa, it was literally the dawn of our democracy. What would you highlight as some of the challenges that you faced at the start of your career in the backdrop of a country that was still, racially segregated, but on the brink of a new future?
Yeah, look, coming from that era, the operation was really that era. We only knew of hardship, and one just wanted to make a difference, despite the fact that the country was in a different direction. But reality on the ground was the fact that the services are scarce, and our people in our communities needed these services, and one wanted to make a difference.
You opened up your practice in the township of Soshanguve in Pretoria. What was that experience like for you? And what did that period in your life really bring to the forefront for you about the communities that you were serving?
Yeah, look, in the first place, I knew that the communities do lack these services. And that was really more to experience firsthand and to make the difference, because by the time you go and want to establish the practice, you have had an experience of being in packed public hospitals and all that, and most of those conditions and everything should have been treated already at their doorstep. So that's really what one was trying to do. Besides the fact that the country was going to a different direction, but the reality on the ground was still, we had to do something for ourselves. So the choice was really wanting to impact our communities.
And what is it that led you to establish Phelang Bonolo Healthcare Group in 2006? And tell us more about this group.
Look, I would say the day-to-day experience and the inconvenience of our people can get access and quality which was a bit far, which they needed to travel and everything. And that was, in practice, you're getting it every day, because these people, you can only do to a certain extent. And you can't complete the loop. Now, to complete the loop and to make sure you have service to a point of satisfaction, and they needed care that they required, and it was a bit far. And traditionally and historically, these things were in urban areas and all that. And it didn't really make sense, because there are people who can afford, in the form of the insurance, the medical aid funds, and some are working these industries and everything else. And the question is, but why wouldn't we bring these services closer to them? Because that alone has got a huge impact. Besides the patient, the relatives, everybody else, for emotional support and all, it's so much convenient, because it's just a walking distance. Instead of spending the money to up and down.
And it looks like, every few years you not reinvent yourself, but you always add another feather to your cap. Because in 2014, you launched your first hospital, Butshilo Private Hospital, also in Soshanguve in Pretoria. What are some of the biggest challenges that you faced in branching into private healthcare, and how do you compete with, quote unquote, the big boys? Because especially in the area of healthcare and hospitals, either it's a government hospital, but not that many, private hospitals that are also Black run and Black owned.
Yes. Yeah, no, I like the period that you're talking about, I would say we'll call it research and development. Once one has identified the need and the demand, one had to go and see how can we go about it. And our importance was that to have a team of people that can buy into the vision that you put on the table, and be able to galvanize the different expertise. And once you got that, then say, listen, now let's tackle this thing. Obviously, the competition was part of the studies to say how are we going to compete. And at the end of the day, within even the practice itself, my philosophy is just do the best that you can at any point in time within what you can, and you will be rewarded by the people who sort of appreciate and see that you're going an extra mile for them. So really, at the end of the day, you would want to follow the best service and the quality that you can get. So that's really the whole thing.
And you launched another facility in the Northwest Province. Tell us more about the PBH, Hartbeespoort facility, and I guess also what it is that makes your healthcare facilities different to other private healthcare providers in the country. You mentioned there that you go the extra mile, but what do you believe are the key differentiators in your offering?
Yeah, look, from the onset, forming the group, it's because we more collaborative and we more community orientated, community centric, and we also encourage healthcare professional participation, and so it's based on the people who will be working there, the people who will have the best interest of the community around. So always we are community centric, we are healthcare professionals in the area centric, and again I'll emphasize the fact that we would like never to compromise on the quality of the service, but we do take the community into consideration in whatever that we do. And and obviously because now we then formed, the group is formed and everything else, and we would like to have a national footprint. It is not easy. It doesn't happen overnight. So over time, I think we'll be able to achieve that. And as long as whoever else who follows in the footsteps will understand the founding principles and would want to extend. And what makes us sleep better is the satisfaction of the communities that we serve.
Doctor, as we wrap up this afternoon, you wear two hats in many ways. One, yes, you are a medical professional, a scientist, a healer, and on the other hand, you are a business person, an entrepreneur. How do you balance the two, and what are the skills that you had to acquire along the way? And perhaps as you answer that question, maybe a couple of tips as well for those who are aspiring to be entrepreneurs or professionals within the health sector.
Yeah, look, I think most important thing is that you need to have the passion of what you do. That's the first thing. I don't get to be reminded to do what I do, and is to make sure you do the best that you can, but acknowledge your shortcomings. So I want to be an expert in medicine because that's what I'm trained for and that's my passion. But I know I need somebody who's an expert in administration, for example, as an example. I'm not going to play a human resource director or I stick to what I know best, and what I know best is medicine. And the other expertise put together, then they form this formidable force that you need to create.
Dr. Mabitje Rampedi, an honor speaking to you this afternoon, sir, and indeed serving our communities in a way that makes a difference in their lives. We thank you for your time this afternoon.
Thank you, man. Thanks.
That was Dr. Mabitje Rampedi, a South African doctor, entrepreneur, and the founder and CEO of the Phelang Bonolo Healthcare Group, the PBH Group. It is exactly 10 minutes to 5 p.m.
The KwaZulu-Natal